start a follow-up session right now. It will be a panel discussion. Amanji is going to be introducing the panelists. I'll tell you a little bit about him. He's the founder, president, and chief clinical clinician of Harmony Healing Center and CEO of Harmony Nutraceuticals LLC. He graduated from the government Ayurvedic Medical College in Hyderabad, India. He also holds a diploma in neuropathy and is certified as a yoga instructor. After that, he completed his doctorate of acupuncture and is a diploma of acupuncture, NCC AOM. He completed his MPH in Health Promotion Sciences from the University of Oklahoma and his MD degree from the University of Health Sciences and Tigor School of Medicine. While he was in India, he co-founded Koheda Herbal States to cultivate medicinal herbs and plants. He serves on the board of several non-profit organizations, including President of American Association of Ayurvedic Professionals. He's also President of Life Transaction Support Group of Oklahoma, National Institute of Developmental Delays, Shawnee, Oklahoma. Ultimate One Home Healthcare is a non-profit organization providing home health care. Interfaith Alliance Foundation of Oklahoma, and Bright High School in Hyderabad, India. We thank him for being the moderator today. He comes with a word of knowledge himself, and I'm sure he's going to do a great job of moderating. Thank you very much.
Thank you, Shivaji. Om Namah Shivaya. Thank you so much for your wonderful introduction, and I'm so excited and happy to be the moderator for an exciting session we are going to have today on integrating mental health and how Ayurveda can be a good part of it. So all my panel today, we are very excited. I'll start from the far left with Professor Dr. Sanjeev Kalra, who is with the MAPI. He's a distinguished professor of MIU Maharishi International University. He serves as the director of clinical training for the field of neuropsychiatry. So one thing in common we have, all of us, four of us here, is we are all BAMS to begin with. We all four of us have been involved in mental health in some form or other. Professor Kalra especially being connected with the neuropsychiatry along with in the hospital management and finance, and he has also an MHA. He's founder of the CEO of Niramed, Center for Specially Abled Children. Vaidya Sanjeev, dedicated to improve the lives of children with special needs. That's the common thing we have. I'm also involved with NIDD, which is National Institute for Developmental Delays. So great to know that. And then we also have our own Dr. Sulekha Reddy. She's a licensed professional counselor, LPC. So she's actively involved in mental health care day to day. I mean, that's her active practice where she integrates Ayurveda in her thing, and she one of the very few of us who's also involved in the psychedelics, assisted psychotherapist in the state of, she's licensed in the state of Colorado, and she has a master's in community counseling from the University of Dayton, Ohio. She's certified health and wellness coach, EFT, which is emotional freedom practitioner, certified yoga and meditation teacher. She's founder of an executive director of Ayurveda. She deals with a lot of to do with the mind and Heartnet Wellness. She's an entrepreneur. She owns mental health franchises called Humanly in Lakewood, Colorado. And she's a philanthropist. She volunteers at NCC BAM. We're going to talk about that a little bit. And she serves as a board member. She's affiliation includes CCA, OCA, NBCC, RP, Corona. And then we have Dr. Gauri sorry, Chair Dr. sorry. She has been an Ayurvedic practitioner and honorary professor in the USA for 25 years almost. She is a healthcare executive, speaker, writer, actor, leader. She has a lot of roles. Dr. Jayapatha has made significant contribution to the wellness field. She serves as a Chief Compliance Officer of Bridges Healthcare, and that's what we're going to talk about, bridging the gap between the Eastern medicine and the Western Ayurveda, Eastern Ayurveda and Western medicine. And she's an author of 3 books, Beautiful Inside Out, Aging Gracefully, Ayurveda Wisdom for Management of Pain and Addiction. So she's involved quite a bit in mental health. I'm not going to take too much time introducing. I will have them talk more about. So what we're going to do is we're going to have a common question for 3 of you, and then we're going to have individual questions, and then we are going to. I want it to be a dialogue rather than being a monologue. So I would really appreciate active participation at the end with your active questions, so we can make this conversation more meaningful. So we will start with Dr. Jayapatha, who tell us about, given the same question for all 3 of you, is how did you get involved in Ayurveda and mental health? How do you integrate Ayurveda in your practices, and what's your experience in mental health? So we'll start with Dr. Jayapatha.
It's working.
Thank you, Dr. Amit, for that lovely introduction of all of us. So, for me, I really did not study the mental health element in the United States, just like Sulekha did or Dr. Sanju, but when I started my journey here, I was an administrator at FQSC, Federally Qualified Health Center. And then, it was more in business. But then, I moved on to a mental health center. I was offered Chief Operating Officer position there. And also I was in charge of residential mental health. By doing that, working with nurses and APRNs and doctors, in my head, because by profession in India, I practiced Ayurveda. I had only for 5 years. So in my head always, how to integrate this, because I used to see it's a revolving door always. Like symptoms, you diagnose the patient, get the symptoms, symptomatic medicine, and then if that doesn't work, then increase the dose, but then there is no door to go out. So then, in discussion with my other executives, I decided to have a group which is integrated, which is mindfulness. I actually designed a group therapy. It is not a group therapy like the therapist does, but integrated into Ayurveda. And every week I used to go there and sit down with the group of 20 people, whoever the admitted patients were, and then talk about lifestyle management, talk about these people, when they get admitted at that time, they are not in their state of mind to listen to all these things and get it. So slowly to start with, okay, how to concentrate. So I started with Ayurveda therapy, like, okay, sit here and concentrate on a candle or object, and that's how we used to start. And started a little bit of meditation, then started talking about the nutrition for mental health, and gunas, sattva, rajas, tama, and introduce them, like how it works with your anxiety. You have doshas, the dosha increased. So it was difficult for them to understand all this, but slowly they understood and then made changes in the kitchen. We used to have a nutritionist also, and the food that is more calming, the breakfast, take breakfast in the morning, the time for the breakfast, the time for the lunch and the dinner. They slowly introduced it into that facility, and that's how it started. And when they started seeing the result of it, like more calming down, and because in residential programs it's really crazy to work with, and every day there used to be some kind of incident. So we reduce the instances with the mindfulness, I would say, to end this.
Thank you so much, Dr. Jaya. Now we go to Dr. Sujata. You can take over 2 minutes. For the sake of time, I think we have a lot of questions. We have 45 minutes, so
thank you.
3 minutes.
So I've been actually practicing mental health for 30 plus years. When I came to this country, I came with the BAMS degree and literally lost my identity. Okay, what the hell am I going to do now? So like when I had, my passion was always mental health because there was a history of mental health and addictions in my family. So that was my focus, either you become an addict or you become an advocate. So I became an advocate. And so I went ahead to get my mental health degree and my license. And Ayurveda does not leave you. You become Ayurveda, And so whatever field that I moved into, actually, it was not that difficult for me to integrate it into Ayurveda, actually. Even though we have a scope of practice with license, mindfulness was not there when I started it. So in Ayurveda, we very specifically have the chikitsa for mental health, right? The Ayurveda, Yukti psychology. 3 pillars. And what I do is my mental framework in that realm is to put everything under that, whether I'm doing cognitive therapy, acceptance and mindfulness based, and EMDR or DBT, any of the modalities that I use, is always falling under that. And based on that, to me, a diagnosis is not that important, but I do have to give a diagnosis for the sake of insurance or whatever that is. But any dysregulation is a desperate need for connection to self. So what is the purpose of life? And what is my purpose here? To help people establish that connection to self. And how do I do that? I use the dosha, kosha, and the higher principles of prana, 4 stages, and the gunas of sattva, rajas, tamas. All of these to actually help my clients connect to themselves and waking up. People have very deep-seated trauma, situational, external, internal, genetic, biopsychosocial, all these factors that are checked out. So how do we bring them back to balance? What doshas are vitiated? What gunas are vitiated? How can we help them? Whether it is dinacharya, brahmacharya, some of the things, depending on the trauma response and everything, they're not ready to sit and meditate, to be honest with you. We have to slowly bring them and not trigger them to re-experiencing trauma. Or, with a depressed state of mind that's shut down, they can't tell them. So we have to do some passive ways of helping them, and then slowly, when they have that 2 terms come to my mind, there's neuroception and the social engagement, so those things are very important to bring them back, to even recognize that they have lost that connection. And so that's where I got the different modalities.
Thank you so much, Dr. Sanjeev. Tell us about how you got involved in integrating Ayurveda into mental health care, and what integrated therapy you choose to provide and teach your clients and patients.
I really appreciate the question being asked to all of us, because we have different stories, very inspiring though, and all of us have experiences. And that started right after my MD when I passed out in 2006. And I came out and with so much hope and everything, I thought that probably yes, this is the right time when I start my journey. But I came across a case of a child around 9 years, mental retardation, which we call it as mandabudhi. So I went back to means I called my boss, who was a leading pediatrician in Punjab, the state, North India. I called him, I said that boss, I need your help, I need you to guide me in this case. He said, Sanjeev, you know, we do use nootropics in this case or some, psychiatric medications, a little dosage, and you can't be able to, you are not able to use those even. But yes, if you have anything specific, Ayurveda, you can go ahead. But I promise that that case you are not going to handle, because that is not your cup of tea. I said, okay, that's fine. So I started my journey. It inspired me in this, I thought that probably, yes, this is the right time when I do something for, because I always loved kids. I thought that probably this is the base where we grow into a full-fledged adults with so many problems. This is not about this kid specifically. And we started seeing in those days diagnosis, because of the diagnosis, autism and ADHD was getting more and more common, right? Because of the advancements in medical settings. So I thought that probably instead of focusing on these conditions, just one, mental retardation, I started with ADHD, autism, and that led me to start my super specialty center, which was first of its kind in India, with Ayurveda. Just Ayurveda, then I started with yoga, integrating yoga, meditation, because I was associated with Maharishi Ayurveda, where I actually practiced again Nadi Pariksha. Then Nadi Pariksha, I started putting that, and all of those modalities with Sapvajay Chikitsa, everything we included, that became my passion for treating and starting off my journey.
Thank you so much, Professor Kalra. And my involvement with mental health was, I used to work at a center called Neuropsychiatry Center and Global Center for Pain Control, where I did facilitate some group therapies. And most of the patients with pain were mostly blue-collar, hard-working people who got injured at work with a lot of disabilities. And they were not interested in understanding any or open to the concept of Ayurveda or doshas or prakriti or vikriti or dincharya. So I had to adapt, and I think that's the message I would like for you to keep in mind. Is we have to adapt to the place where we are practicing. So I had to adapt there instead of calling the dosha and all that. I had to just use their language. Most of all, they were like blue collar, regular babas, meat, potato, steak kind of people. So I had to just use their language, their terminology to explain that this is how you can use mindfulness, or instead of calling it mindfulness, just be aware of it. Just listen to your body, listen to your mind. So I think somehow for us to improve or make Ayurveda more popular, we would need to adapt to the country, to this dish. So my next question would be to Dr. Jaya Daptada, because she uses a lot of mindfulness in recovery of addiction, and she wrote the book Train Your Brain, and she also does a lot of work from beauty from inside. Can you in a nutshell tell us about your books in about 2 minutes, 3 minutes?
So, regarding mental health, Train Your Brain is not my book. It is a program that I developed. Because like I said, I work with a residential program and teach them how to discipline themselves. Like I said at the beginning, they're not in the state of mind and they don't understand all other words. So what I started with them, how to discipline yourself, is I created a worksheet for them from Monday through Sunday. What needs to be done? In the morning, what time you wake up, what time you eat your breakfast, what time you drink your warm water, what time you do your yoga, how much you do, and then with the spreadsheet just to check mark daily basis. And I gave them a goal. Everybody has to pick up their goal every week and work towards the goal whole. And the next week in the group, we used to discuss and celebrate. If the person picked up the goal that I'm not going to eat candy for a whole week, and I understand they're going to eat the candy, but then they will be skipping days. So that's their celebration. Okay, you skipped 4 days this week. And by doing this, before they get discharged, they train themselves for something, some discipline they get. And then after that, there's a follow-up. So in the follow-up, if, not 100% of them, they follow everything. But at least I have seen so far, 70% of them, they follow up. So the reason doing this is recovery is not just a discharge and you're recovered, but it has to be the permanent recovery. It has to be the recovery to celebrate every year. And that's how I talk to them to change their mind day by day, slowly. And by the time they get, sometimes they're there for 3 months, sometimes 4 months. So by the time they get discharged, they get discipline. And that's how I developed that program and called Train Your Brain.
Thank you so much. My question to now Dr. Sulekha Reddy, since she is a mental health practitioner. So my question to her will be, how can us as Ayurvedic practitioners expand a role in addressing mental health while staying within the ethical and legal boundaries? What are the differences between Ayurveda and the Western psychology and understanding the root cause of mental illness? Question to Dr. Sulekha Reddy.
Yeah, the first part of the question was about practicing ethically, correct?
Yes.
So, yeah, boundaries. So one of the things that Ayurvedic practitioners can do is, first of all, have paperwork in order, the consent forms, the consent to touch, the professional disclosures, and your scope of practice. These are all very important to actually communicate and then also disclose that you're not allowed to diagnose and treat anything, except that this is your scope of practice and you're only going to recommend, and also give authority to Ayurveda and talk to them like in our text. It is not mine. This is a training I received that in our class Ayurvedic text, this is what is mentioned. So you're out of the picture. You're not putting yourself in jeopardy. It's not your claim. It is the Ayurvedic science and the class of text that you have studied from. That's one. And another thing is to really recognize when you need to refer your clients to a licensed healthcare provider. That is very important that you collaborate with the healthcare licensed providers. If there is a need to do that. That way, your paperwork is clear. You're referring to them to another healthcare provider. You're supported. So that's one. And ethically, practice do no harm. And we have to make sure that the client understands that we cannot cure them. We're only going to help them. And we have Ahara, Nidra, Brahmacharya, 3 basic, kastambas that we keep in mind, and then we, in that framework, start to bring them back into the biorhythm of the nature. itself because we are part of the whole. And the second part will be
What's the key difference between the Ayurveda psychology and Western psychology?
So, Ayurveda psychology, we don't consider our mind as a separate part. Manas is everywhere. So we know that. So we don't treat mind as a separate part. So if we want to reach our mind, we have to work through the body. And if we want to reach any disease in our body, we work through our mind. So that is the basic principle of Ayurveda too. So that is the big difference, that we encompass all mind, body, and spirit into our treatment protocols. But in the Western conventional system of medicine, it is more of behavioral therapy. So there is talk therapy a lot. There are different modalities and tools, like I mentioned, cognitive therapy, working with their irrational thoughts, cognitive distortions, which is the flaws of our mind, the way it is thinking. Remember, we are all only, we are built to only to survive, and our amygdala, is the one that is always trying to fight, flight, or freeze. And so, bringing the clients back to their rational mind is a huge, therapy itself, recognizing that and how they can actually change their mind. Like Jaya was saying, change your mind, change your life. So that to do that does take a while. And each individual, going from just adjustment to real PTSD is a huge spectrum, and time is the essence. So with the conventional system, there are other modalities like EMDR, eye movement rapid desensitization, and there is TMS, which actually works with a very small frequency of electrical pulses. So these are the new developments, and of course, we have also the mindfulness-based practices now with a lot of research. So slowly but surely, Western system is recognizing the Eastern modalities, but it is here. So we can definitely, as Ayurvedic practitioners, I think we know how mantras, how yoga, how pranayama, how aromatherapy, how panchakarma, all of this helps, in regulating our mind and body.
Thank you so much, Dr. Sujata. It's another takeaway message here would be to find a common ground between the Western and Eastern. Like in Ayurveda, we have Vata, Pitta, and Kapha. In Western medicine too, or in psychology, there are mild brings kind of classification. When I went back to med school in Sulekha Reddy, I could see this. There are ways we can build a bridge. When I did my Chinese medicine, that's a lot of common, like Panchamahabhutas in Ayurveda, and they have also 5-element theory. So there are a lot of common grounds. So if we can have an open mind and open heart, like they say, mind and bridge, mind and parachute work only if they're open. So like Dr. Vivek was saying, Narva was saying that learn from other systems to have more tools in your bag for offering to your clients, to your patients, so they can get more bang for the buck, they can get more benefit from your expertise. So my next question will be to Dr. Kara about, since you have been working in mental health and you were involved with the prestigious mental health institutes in India, tell us about your experience in working with the mental health, psychiatry, Manas Road situation, setting in India, and how you are able to bring that expertise with your work in Maharishi and Faith United. Thank you.
Thank you, Dr. Ahmed, for asking this, because again, I appreciate this question, and this is a beautiful thing that when I started my journey, I have already mentioned that, but after that I thought that probably I should be working with one of the institutions which offer full neuropsychiatry there. So we have WIMHANS. As we have WIMHANS in Bangalore, we have WIMHANS right from 1980s in Delhi.
What's WIMHANS?
WIMHANS.
can you, what is the?
So NIMHANS is National Institute of Mental Health and Sciences, Neurosciences in Bangalore, which is government-backed, premier institution of India for brain and mental health. So we have on the same lines, it was actually from NIMHANS, basically probably they got inspired and put the name NIMHANS. NIMHANS is in Delhi. So NIMHANS is Vidyasagar Institute of Mental Health and Neurosciences. So NIMHANS, I started going there as a psychiatrist. So it was odd, one out of several psychiatrists who were traditional modern practitioners, and I was just one. I was a doctor from psychiatry and had 3 years of experience when I started going there. But what I learned from there, and it's always good to learn to go back to your basics, as you mentioned about doshas and everything, the same kind goes there, just avoiding conflicts. Yes, scientific basis we want, evidence based. And that's what I started learning, that yes, we have to, what she mentioned about collecting data, right? I started working for my clients, patients at my center for collecting data for ADHD, autism, retardation, or many more. So I thought that probably because they have something in their hands. They are not like, okay, you just put medications for any mental health condition, whatever you go across, or neuro conditions. No. But in Ayurveda, we consider under them Vata, Pitta, or Kapha conditions. But we have those understandings, very basic understandings from how they interact, how they produce conditions, right? And how we can collaborate on those bases. We have Vata and Kapha. Other gunas are Rajas and Tamas. Sattva is, they are considered doshas as well. But Sattva is pure, so it is not considered as dosha. So apart from that, in allopathy or modern point of view, they look at thoughts, feelings and actions, AFT, or cognition, and effect. If there is an imbalance between these three, they can create any mental health conditions, right? So how we can look at Vata Pitta Kapha interaction, and how we can look at AFT, feelings, effects and thoughts. Thought is the basis basically. What leads to the problems, actions, right? Right from the consequences to the from the basics of reasons or thought processes to the consequences.
Thank you so much, Dr. Kalra. I think we have about little over 10 minutes to wrap up. So I'm going to take another 5 minutes from Dr. 2 minutes from Dr. Sujata, because she works a lot with psychedelics, and her experience in using psychedelics in her practice. It's a $1 million research going on. In fact, there's more research going on in psychedelics and mushrooms than I think in the whole Ayurvedic field. And then I will ask Dr. Khanna about his experience with Vijaya, medical marijuana, which is a huge $1 billion industry compared to Ayurveda, which is a couple of $1 million. So Vijaya is our sacred herb, from Ayurveda, which came from the Samudra Manthan. So that would be my second part of the question. So we'll start with Dr. Sujata about her experience with psychedelics and how you integrate that in, and also how you keep in mind, like it's a very traditional native healing art of using psychedelics. How you honor these traditions of shamans in your practice, and then how you integrate. Thank you.
Thank you, Amit. Very important topic actually, and close to my heart. So, in my practice of so many years, I have seen clients really not get better. Chronically, they are going to therapists and taking psychotropic medications, and there is no relief to this symptom. It alleviates symptoms, but actually the root cause and really waking up from that is not as much. So I did, go ahead and get my fellowship in psychedelic assisted psychotherapy, and practice that with ketamine, assisted psychotherapy, and psilocybin assisted psychotherapy. Ketamine is federally legal, and psilocybin is legal only in 2 states, Oregon and Colorado. Now, psychedelics is not new to Ayurveda, just so you all know. Okay. Evan, can you put up that image I sent you? Okay. So I do want to make everybody aware that this is nothing new for us. In fact, in Ayurveda, we have different psychedelic medicines that we actually make formulations. One of the psychedelics is Datura, and that is included in a formulation, one of the formulations of Pancasava, which is used for respiratory infections. Okay, so in many forms there are psychedelics integrated into Ayurveda. It's just not taught as psychedelics. That's how we can use it. So the whole principle of integrating psychedelics falls in our own. So in Ayurveda actually encourages us to move higher in our state of consciousness. That is the whole purpose of life, to evolve in the state of our soul and our consciousness. Now we have the chakras, we have the koshas in yoga, correct? So think about those. Whenever Ayurveda is treating a condition, then at what level, to what level can we treat it? Okay, in terms of koshas, whether it is Annamaya kosha, Pranamaya kosha, Manomaya kosha. Most of them only reach to Manomaya kosha. Okay? And now psychedelics, when you introduce psychedelics, it gives you a glimpse into the Vijnanamaya kosha, which is the power of discrimination, is what you achieve, and a window into sattva. Okay? This sattvic state, the state of Anandamaya kosha, can be achieved with psychedelics. It will break that deep, very, very rigid thought patterns and rigid, like we call it default mode network. It truly will break that and then give you a glimpse of that. So now from that place, you're able to actually see things very differently and very clearly, and then you are able to start working on where you need to be. States of meditation, by the way, we don't actually, meditation is really for normal people who can get to a higher state, but when things are not normal and they're so dysregulated, meditation is not going to help. We have to start from very basics of observing your breath, and just, some people cannot even sit for 10 minutes, they feel such high anxiety. So I just tell my clients, just sit down on the hour, just become aware of your breath and breathe just for a couple of minutes. That itself will bring their pressure down and the stress levels down, and they can function. So psychedelics is not just with the psyche state of the using psychedelic medicines, but also we can use breath work, like the holotropic breath work or hallucinogenic breath work. These are also will take you to those mystical states. And then a lot of these things, we have the limitations and we have the ama, what we call as, at the level of all these koshas can be cleared out. So that's where psychedelics come. And if you see that picture, can you tell me from which temple it is? In India, it's the Khajuraho temple. So it is showing mushrooms on both hands, right? So it is not new to India. And there is a mention of soma in the Rig Veda. So if you all know what soma is, soma can be a state of mind, soma can be a medicine, single or a combination, and it can be an enlightened state too. So soma has different meanings in different contexts.
See, what it does is just it helps to lift the clouds and settle the dust. So thank you so much about your explanation about soma. As she said that they had mushrooms in hand, and then when Lord Dhanvantari appeared, he did appear with some Vijaya, so I'm going to.
I just wanted to add one more thing, if you don't mind. So how do I integrate it with Ayurveda, right? So there is Purva Karma, Pradhan Karma, and Paschat Karma. Same thing, when we are doing the psychological assisted therapy, there is set and setting, there is preparation, which can be even like 2 months before the actual day that we are going to administer psychology. And then there is integration phase, which is the integration we do with Ayurveda. You know, because one can integrate using the cleansing, the preparation, you know, to really soften their karma, you know, so that when they actually go into the psychedelic experience, they have a deeper experience and deeper perception. And then I go into the integration phase where whatever they have received and experienced, how they're going to move forward with implementing that and they change their life. You know? So new neuronal transmitters are developed and they can reuse it and the default mode network is done. So,
Thank you so much. In fact, there's millions of dollars are being spent funded by the NIH, National Institute of Mental Health, for funding. In fact, at Oklahoma State University, which is a very traditional university in Oklahoma, where all this funding is going for research in the psychedelics and mushrooms. So that's amazing to see the research coming, especially with ketamine. So now we go to Vijaya. Dr. Sandeep Kalra, you can tell us about what is the evidence of medical cannabis in treating things like anxiety, PTSD, depression. How do different cannabinoids like THC and CBD and all that are used in cognition and mood? What are the risks? Because every light has a shadow. So what are the shadows of cannabis and how clinicians can use it in their practice? And I do suggest for my patients to use cannabis, especially severe pain, severe Parkinson's. It's a game changer in a lot of patients.
Thank you, Dr. Amit. And here, Vijaya is why it is called as king of the herbs. And as Dr. Amit mentioned about, this was the first herb came out of Samudra Manthan after churning out that thing. And that was because Vijaya is a sacred herb, not only because in India it is offered to gods, but also it was being used medically in older times. And several conditions, what Dr. Amit has mentioned about, it was used for females, first of all, for menstruation, painful menstruation, right? Then for cancer patients, though in older times we didn't have so many cancer patients, yes, for painful conditions which were not, which couldn't be treated with simple herbs, pain herbs, this was the answer with combination or as a single herb, Vijaya. So when we get to the basics of this herb, this is considered to be one of the best herbs. Why? Because it acts on cannabinoid receptors in the brain, mesolimbic system of our brain, where our thought processes, stress, thought processes after that, and memory, they get to act. They become active, right? So there, it acts on those receptors in the brain. How? But I would like to talk about more about the Rasa Panchakas, Ayurvedic perspective here. Because Rasa Panchaka, when you see for any herb, you will come to know that what exactly is going to interact, where exactly it is going to interact, and what would be the outcome. So you will come to understand everything from one plant's morphological aspect and what exactly it is used for. So that plant is basically available everywhere, wherever you go in Indian parts. Roadside, you will find that plant easily. But that is considered to be semi-poisonous. So it has to be first shodhana. So what needs to be done? Processing of that plant. That is not used as such, it is abused nowadays. Abuse means in India, very simple, in other simple words I am telling my state where I come from, Punjab, that is totally under this. They get it very easily, roadside, make pills on the road, put it in the mouth, and they are done. I am telling you the condition. and people die of the overdoses, adverse effects, right? So we use that plant just for the help of the people, patients, right? We Vaidyas used to give that plant, right? So the processing is the first thing, and then we come to know about what exactly it is going to do, and it is considered to be, if I say that it is kapha shamaka, vata karaka. Vata means active, makes you active, little active, right? But at the same time, it is also pitta. Pitta. Sometimes anxiety, angerness increases if given in large dosages.
There are two species of main species of Vijaya. One is cannabis sativa, which is stimulating,
Yeah.
and this cannabis indica, like Indians, is very calm. It's calm.
Calm.
So there are two, and then there are a lot of hydrates.
Yes.
So cannabis was used a lot extensively before the invasion of British. It was poor man's medicine, and when the British came to India, they brought the pharmaceuticals and they brought Scotch.
Yeah.
And to promote their Scotch industry and to promote their pharmaceutical industry, they made it illegal. Otherwise, it was used very extensively.
So also, these days that how marijuana is available, the THC levels in that are so high. I get cases of marijuana psychosis. And it's, once they have the psychosis, we also have to look for their predisposition or genetic history of schizophrenia. They can never ever touch it. You know? So we have to be very careful with what we're working with and how they're making different, very high active THC concentration,
Yes.
and we have to be very careful with that.
Yes. In fact, we need to grow and it's to 28% THC. Normally, the fat cannabis will be about 2%. So we are running short on time, so I would ask 1 minute question to Dr. Kala, since he heads ICAA. How can ICAA facilitate the bridging the gap between the Eastern or Ayurveda in the future, for the future practice? And my next question will be to Dr. Sujata, since she's on NCCPAM, how NCCPAM can be a platform for bridging the gap of Ayurvedic practice in the future. 1 minute each.
Yes.
Then we'll have 2 questions for the audience.
So we have the biggest task is to standardize anything. So protocols again, SOPs, standard operating procedures, or protocols we have to develop for standardizing the education labels. Because this is not something that these are candies we can give to anyone, whoever is coming. This is something whoever comes in to learn from the roots, what we have been actually training or teaching in authentic way. So this is something we are working on, developing the protocols, the standards for education, how it can be integrated here, how it can be taught, and then the institutions where we can offer this program, which would be extensive program on the lines of a natural medicine doctorate.
Thank you. Dr. Sujata, about again bridging the gap to the future.
Yeah, so EMS Vaidyas coming to this country really feel a little lost. So in this country, there is no Guru Shishya Parampara, right? So everything has to be credited, everything has to be certified, everything has to have a formal label and a scope of practice. So right now at NCCPM, we are only in the level of grandfathering Vaidyas. And just like NCCPM, we have other, we have the NAMA CD and the NAMA also, they also have the other certifications and they also have the, AAC education level. So understanding that, how we can all raise the standards of practice in this country is very important. And so, I would encourage everybody to recognize the importance of any credential, which is so important for us to then get licensed in the future with every state because it is state dictated, it is not national. So that's
Thank you so much. Now I'll open for quick questions from the audience. I'll come with the microphone, and if you have any question for any three of us. Dr. Minashi.
Thank you so much. My question is to you, Amit, regarding the use of Vijaya for the pain. In Samhitas we have mentioned, but I would like to know what your experience is on Vijaya on the skin. Like right now we get the marijuana oils,
Yes.
and if it can be incorporated in the skincare.
So what I'm using is mostly CBD in skin condition, and pretty good results, especially for with skin conditions with a lot of pitta, with eczemas, with psoriasis. We use CBD internally and also topically. In our practice, we can't. In Oklahoma, you have to be a licensed dispensary. So the dispensary is not in my clinic. So we have to get it sent out so them to a clinic, and we do send them to a clinic where they have bud tenders. They sell gummies with THCs, and they are very specifically tailored hydrates to take care of those conditions.
Let me rephrase a little bit. I don't want to take maybe other people have the questions. It's not about the skin condition. It's about the skincare, like what cleanser or the moisturizer, that type of skin.
Yeah. So we use CBD-based topical ointments. Yeah. Especially with people with radiation, it helps a lot with the radiation. People in cancer and help them with the side effects of neuropathy. We use the pain management. Yes.
Thank you.
Anyone else, please? Yes.
This is very interesting panel. We have a manufacturer, we have two practitioners, and we have one educator. They talked about the future of psychedelics in this country. I would like to understand the current status in terms of manufacturing, because we have lots of Ayurvedic supplements that are being manufactured very proudly. So are there any Ayurvedic psychedelics that are being manufactured? Second thing, is there any current plan for including this topic in Ayurveda education? And third question to the both practitioners, how do you implement and what kind of products do you use? I know this is a long question, but I would like to hear one line answer from all of you. Thank you.
So I'll take the short first. With being a manufacturer, I would definitely recommend people to use products which are definitely, it may sound biased, but manufactured in the US, so you have better liability, because the biggest issue in practice is liability. Anybody can sue anyone for any reason. So when you buy products and dispense products or recommend products which are made in the US, you have a much better support and liability issue. So that's what we do, is we manufacture everything in Oklahoma. They are FDA inspected, FDA registered, GMP certified, which are audited, and FDA shows up at our place anytime. So, and I'll.
Yeah, so, am I audible?
Yes,
No.
you are.
No. Oh, now you are.
No, okay.
No, that was me.
Actually, she's
There you go.
not. Yeah.
Yeah, so in the state of Colorado, psilocybin mushrooms are decriminalized, and so you really can grow them, but we have to be very careful that contaminants. So as a licensed professional and a licensed natural medicine investigator, I have to get that from a licensed manufacturer, tested, and so that has its own process and costs that come with it, to administer to my client. And there's handler's license, there's manufacturer's license, there's business license, there's facilitator's license, and then we have to only do it in a licensed microbreeding center. So there are so many steps to it, and it is DEI, you have to follow all the DEI steps. I have a camera where I'm storing the mushrooms, constantly, and there's no abuse, and there's expiration date, so there's a lot of things. Now, how do I integrate our Ayurvedic herbs, right? So, psilocybin, I look at each person's prakriti and vikriti and see what is the properties of the mushroom itself. If it is highly, a dosage and how with their prakriti, vata liberating. You know that Prakriti is vata and the psilocybin also is highly vata, is very penetrating and highly vata liberating. So I may add some, ashwagandha a little bit to it, so that they're not like too off, so that they can kind of come down a little bit. And post also, the integration with Ayurveda, with the Panchakarma, the Vyamvashivadara, this is very important. And other drugs like Brahmi, also I use. And nowadays, the nootropic mushrooms like lion's mane, and all the other mushrooms, that I do add them when I'm giving just the pure psilocybin also. So that helps mitigate all the extreme active, principles that cause a little bit more agitation and distribution.
Thank you. And you made Ashwamedha, that's an amazing product. Dr. James, Sulekha.
Yeah, so my question is, I have tried all the psychedelic medicine in a traditional setting. So say ayahuasca, I have done in a traditional setting, ibogaine, San my question is that my observation was that all the psychedelic medicine works firstly on the ahankara tattva, and they work differently. So my question is that taking the psychedelic medicine in that traditional setting and taking that in a clinic or in a hospital, because the entire ecosystem, how does that work? For example, ayahuasca has a kind of a peculiar spatial songs that works as a software to activate the drug inside. Same with the POD. So as you deal with the psilocybin, have you ever tried certain Indian classical drug with psilocybin to work it as a software to make it more maybe permeable, penetrative, and long?
So psychedelics, I use a lot of the, first of all,